If you ever have a medical emergency and have to call 911, the improved level of ambulance and fire response you'll receive will be owed to Tracy Gunderson.
BC Ambulance for what city, please?
Vancouver, I'm bleeding profusely.
Hang on, what's the address you need help to, ma'am?
What?
With that, the clock started ticking on Gunderson's life last November. The 56-year-old woman with a drug addiction, bleeding from an abscess. An ambulance arrives outside her secure downtown Eastside apartment building at 250 Powell within 5 minutes.
I'm all dizzy and blurry.
I understand. Just hang in there. We're going to be there soon to help you.
But they weren't. Ambulance crews couldn't get through the locked doors of Gunderson's building. And fire crews who have master keys to multi-unit buildings like this weren't called in to assist until it was too late, even though the closest fire hall is half a block away. It took paramedics 35 minutes to reach Gunderson's lifeless body.
No one should call for help and not receive it.
Gunderson's daughter, Chelsea Brent, demanded answers, angry that a controversial policy change in May 2018, brought in by BC Emergency Health Services, which oversees 911 response, stopped firefighters from attending all but the most urgent medical calls.
It brings me to tears often because it's not something that you ever wish on someone, to die alone scared and wondering if help was ever going to arrive.
Chelsea wrote to BC's health minister appealing for a review of her mother's death. Adrian Dix agreed to launch a sweeping investigation. Now Dix has accepted all 14 suggested changes to the province's 911 system, made by 2 independent outside emergency care experts.
This is a serious case. It's a tragic case. It's a heartbreaking case. And there are lessons to be learned, and that's why I did it.
The report's finding that 911 policies and actions need to be revamped to improve care of future patients. And among the recommendations, the need for better communication among dispatch, ambulance, and fire, and that fire crews be dispatched where there is any suspicion of access delay. Dix denies it's a rollback of the efficiency cuts made in 2018, 6 months before Gunderson's death.
I don't think it's a rollback at all. It just makes sense.
BC Emergency Health Services says it welcomes the recommended changes to 911 and will work with the Health Ministry to prevent something like this happening again. The Vancouver Fire Department says it supports the findings and believes fire crews should be sent to any emergency where its fast response times can improve patient outcomes. Chelsea Brent just says she's glad her mother's death will help others.
I know she never liked attention, but I think she would be thankful.
Eric Rankin, CBC News, Vancouver.